Good morning, guys. Welcome to Pioneer Advanced Hair Transplant Center. Today's video, we're going to present a topic on how did we achieve best and natural hairline. And that's the video we're going to make today. And of course, many a times we spoke about how did we achieve the best results and what are the plans and what are the designs we discussed many a times. But and again today we would like to bring one live patient, like patient results. So what are the things that we implemented and executed to get the best hairline? That's what we're going to present today. Kindly watch the video until end to understand the basics of this video. Before getting in details about this patient, usually most of the patients will ask us, why would we need hairline looks like a very small area? Why would we need this many grafts and why this will take this much time? And they will ask this question. Most of the patients will have doubt saying that this frontal area class 2 or class 3 baldness looks very small, but why do we need one day, one full day for this procedure, almost 6-7 hours, and why do we need this many grafts? Usually most of the patients think that frontal small area, it's very easy to do the transplantation. Actually, it is other way around. Usually doing class 2 baldness transplantation is always more tougher than doing class 5 baldness transplant, because the frontal area, when you talk about the results wise or execution wise or surgery wise, it's kind of more precision you need it, and it's kind of more planning we need it, and that takes a lot of time. That's a very important thing to be understandable thing here is always this class 1, class 2, class 3 baldness will take a lot of time for surgeon, and it takes really more grafts also. It's not easy when compared to the large area. Usually common man thinks that it's not a big large area, it's not a large area baldness, right? Why do we need this much time? So it's actually wrong. And class 2 baldness surgery, doing class 2 baldness surgery is always very difficult because of many precision things we need to talk about, and while doing it, it takes a lot of work and more precise work has to be done. That's the reason. So we need to take a lot of time to do this. Number two is this patient, we achieved best results because if you can observe this, it's a class 2 or class 3 in between a kind of a baldness. We didn't want to bring the hairline down because I'm sure he's going to lose more hair in future. So we had a good discussion with the patient, and we explained the consequences of the bringing the hairline down. The patient was actually said, fine, this is the best hairline I really wanted, and he always looking for the natural hairline. So we suggested in the best suitable hairline design, including little temple area implanting. But kindly remember, we did not bring the hairline down and even temple angles also. That's the beginning, the best step for the getting the best and natural hairline. You can see the markings are done in such a way that it's suitable to his plans, where he is going to get best natural hairline after the results. Well, surgery went very well, and we always implant single follicular units in the frontal area. And second thing is angulations. More acute angles if you try to implant, more acute angle to the surface of the skin. We need to, it will changes area to area, of course. So that part we need to take care of while implanting, and even a proper precise depth and orientation of the grafts placement. All this really matters. So all these three, when it goes in the best hand, you can achieve always best results. That's what we did in this patient. You can see the density volume that is built in the frontal area, even sides. You see front side, even top view, and even left and right views. An excellent outcome we achieved it. These are all just possible just because of the meticulous plan and implanting in a precise manner. So that's the beauty of transplantation results one should watch. Of course, this is particular to this class 2 baldness guys we are talking about. And when you come to the class 5, class 6 baldness, we need to do little more on grafts. So whereas this discussion is limited to this patient, whereas class 2 or in between class 3 kind of baldness. We achieved best outcome after 10 months. Conclusion of this video is usually the design of the hairline itself can make you whether you're going to get a good hair, good density and good natural hairline or not. That's the basic step for this kind of getting good results to achieve. And if you take 1 centimeter down, or if you try to implant the temple angles for this patient, I am sure this transplantation results goes to the toss. And one should not think about implanting that way. There are a few calculations we're going to do. The particular to this patient, we made a few calculations by measuring the facial thirds, and then we designed such a natural hairline. That varies to person, that we need to understand it. That when we come for the discussion for consultation time, we can do have a discussion about each patient and then customize the plan for them, and then we execute the surgery plan. That's how we achieved best results in this patient. Thanks for watching.